facility with RNA technology?
Were reported. That is 250 cases and 6 deaths every minute that we know of. The rate of decline in most regions has slowed. And every region has countries that are seeing a rapid increase in cases and deaths. In Africa, the number of cases and deaths increased by almost 40% in the past week. And in some countries, the number of deaths tripled or quadrupled. While a handful of countries have high vaccination rates and are now seeing lower numbers of hospitalizations and deaths, other countries in Africa, the Americas, and Asia are now facing steep epidemics. These cases and deaths are largely avoidable. There are several reasons for this increase, including the increased spread of variants of concern, more social mixing, ineffective use of public health and social measures, and vaccine inequity. The inequitable access to vaccines has demonstrated that in a crisis, low-income countries cannot rely on vaccine-producing countries to supply their needs. We haven't seen it before with HIV, when people in low and middle-income countries couldn't access life-saving antiretroviral treatment. We have seen it with diabetes, where insulin is priced high despite having been around for more than a century. The COVID-19 pandemic has shown that relying on a few companies to supply global public goods is limiting and dangerous. To boost manufacturing, WHO has continued to call for the sharing of know-how, technology, and licenses, and the waiving of intellectual property rights. Enhancing local production of health products has been an area of focus for WHO for several years, but the pandemic has brought it into even sharper focus. Just a few weeks ago, the World Health Assembly adopted a landmark resolution on strengthening local production of medicines and other health technologies to improve access. And today, I joined the World Local Production Forum, which aims to strengthen production capacity where it exists and to build it where it's lacking. In April, WHO issued a call for expressions of interest to establish technology transfer hubs for COVID-19 mRNA vaccines. Tech transfer hubs are training facilities where manufacturers from low and lower middle income countries can receive training in how to produce certain vaccines and the relevant licenses to do so. mRNA technology has been in development for decades and is the basis for at least 2 safe and effective COVID-19 vaccines. It's potentially easier to scale than other vaccine technologies and could be faster and easier to adapt to variants of concern. Following our call for expressions of interest, we received more than 50 proposals, about half of which were from companies or institutions interested in receiving technology, and half were interested in providing the technology or acting as the training hub for or both. Today, I'm delighted to announce that WHO is in discussions with a consortium of companies and institutions to establish a technology transfer hub in South Africa. The consortium involves a company called African Biologics and Vaccines, which will act as the hub both by manufacturing mRNA vaccines itself and by providing training to a second manufacturer called BioVac. In time, Afrigen could provide training to other manufacturers in Africa and beyond. The Africa Centers for Disease Control and Prevention will provide guidance through the Partnership for African Vaccines Manufacturing. WHO is facilitating this effort by establishing the criteria for the technology transfer, assessing the applications, developing standards, and providing ongoing support and training. We are now in negotiations with several companies that have indicated interest in providing their mRNA technology to the hub. This selection will be based on how advanced the technology is in terms of clinical efficacy data and on the terms under which the company is willing to share its technology. In the coming weeks, we will continue to assess proposals for other tech transfer hubs for mRNA and other technology platforms. It's important to emphasize that this is an important step that will yield results in the medium term. In the short term, we need to do everything possible to increase the equitable production and distribution of vaccines through COVAX. To say more about the South African hub, it's my great honor to be joined by His Excellency President Cyril Ramaphosa of South Africa. President Ramaphosa, thank you so much for joining us today again, and you have the floor.
Thank you very much, Director General of the WHO, Dr. Tedros Ghebreyesus, and your excellencies who are in attendance, and ladies and gentlemen. This is really a joy to join you, Dr. Tedros, in this landmark announcement, because today marks an important milestone towards the achievement of one of the critical objectives of the African Union's Agenda 2063, the Africa we want. The ability to manufacture vaccines, medicines, and other health-related commodities will help put Africa on a path to self-determination. Through this initiative and others, we will change the narrative of an Africa that is a center of disease and poor development. We will create a narrative that celebrates our successes in reducing the burden of disease, in advancing self-reliance, and also advancing sustainable development. This will enhance our capacity to take responsibility for the health of our people, for the health of Africans. We will be able to plan for the entire value chain, from training a critical mass of young people, enhancing and maintaining our supply chain, and ensuring the efficient use of medicines. As South Africa, we intend to pursue these objectives in close cooperation with other countries on the continent, enhancing regional trade and investing in science and innovation. Now, debates around improved access to medicines, diagnostics, and vaccines have been ongoing for many years, but they've reached their high point now as we are dealing with COVID-19. They've reached a high point because there is inequity and inequality. The countries of the North with more developed economies now have even more than 50% of their citizens vaccinated. And the countries in the economic developing world are still struggling. Those in the North, as you correctly said, Dr. Tedros, are now having lesser and lesser hospitalizations. And us in the South are still struggling for access to vaccines. And the vaccines that are made in their billions in the countries in the North, we do not have access to them. And other countries in the North have a huge surplus. And we've been saying vaccine nationalism must come to an end, because this pandemic we are facing together, all of us around the world. And it is just not equitable and not fair that some people in certain countries, and because they come from rich countries, their lives are worth much more than the lives of those in poorer countries. We need solidarity. We need equitable access, but we also have called for a waiver, as you correctly said, which the WHO supports, of the TRIPS measure to enable all countries, those that can, to be able to have the wherewithal, the IP, to be able to manufacture vaccines. Today is historic, and we see this as a step in the right direction, but it does not detract us from our original proposal put together by India and South Africa that we should see a waiver of TRIPS at the World Health Organization. And we would like the negotiations that are taking place there to proceed with speed, because, as you correctly said, Dr. Tedros, people in Africa are facing a rising wave of infections. In South Africa, we are facing the third wave, which seems to be more severe than the first and the second one. And the only defense that we have is to have vaccines. We therefore thank the WHO for taking this bold step and commend member states for moving us from discussions to real work and realistic development. This is the start of the process. As we work together to respond to this grave global crisis, we see this as laying a firm foundation for the achievement of health security for the world's most vulnerable people. In the achievement of this goal, we will not fail. We thank you once again for this opportunity. With this investment of technology, knowledge, and expertise, we will go beyond the development and manufacture of vaccines into a new era of innovation and progress. And this initiative should never be seen as just being an initiative that will benefit South Africa. We want it, and we will make sure that it benefits the entire African continent. We will be working with the Africa CDC. They will guide us, they will help us, and of course, we will be working with the WHO for guidance, for advice, and also for new technologies as we move forward. So I would like to thank you. This is the first on our continent, and we really are grateful for the step that has been taken. Thank you very much, Dr. Tedros.
Thank you. Thank you so much, Your Excellency, President Ramaphosa. Thank you for your continental and global leadership. Thank you for your leadership specifically on IP waiver. And today's launch is a great step forward for South Africa and for the world. I hope this will be a key moment for increasing production capacity in Africa for COVID-19 vaccines, but also for future vaccines. France has been a strong supporter of local production, and His Excellency President Emmanuel Macron has been personally committed his time and resources to work with WHO and our partners to achieve this goal. President Macron would not be with us in person, but he has sent us this video message.
Monsieur le Président de la République, cher Tedros, pour l'Afrique. Et c'est aussi un grand... Santé. Comme je puis...
And that there is French President Emmanuel Macron. Of course, what he will then be doing is to be reinforcing the message that had already been put out by the WHO doctors, Tedros Ghebreyesus, the Director General, and of course he is making that announcement alongside President Cyril Ramaphosa. What it is that South Africa will be the host of the first COVID-19 vaccine facility using messenger RNA. It's a breakthrough technology, of course, that has been used for the global inoculation effort against COVID-19. And what has been announced is that Afrigen will work together with BioVac, and what they'll do is they'll produce the technology here, which President Cyril Ramaphosa has just said won't be just for the benefit of South Africa, but obviously Africa. And what will then happen is that there will be a collaboration with other companies, the WHO Director General says, but they will be chosen on the basis of their clinical efficacy, he said, and of course their willingness to share intellectual property in the development of this technology. Let's take a quick break. We'll see if we can return you there and see if the technical problems that they're experiencing there have been resolved.